for the types of surgeries that you're doing and how you like to use it. This is an example of a lumbar decompression. So you can see this one here, you can see the ipsilateral side. And then if you're doing like, minimally invasive, or even if you're doing an MIS TLIF, this is actually a really cool application. You can reach across to the other side. So instead of going with like Caresins, you can reach this thing right over to the contralateral side and do your decompression. And I think that's probably one of the best uses for this, in fact. This is another one, just looking at the difference between the high-speed drill and then using the Dreal device. Just less bone removal, preserving stability, preserving bone mass in the event that you had to do a fusion down the line, and just limiting the amount of surgery that you're doing. Again, here's just an image showing where the drill kind of limits. And I think like most cases, you get to that point. And I actually use my Sonics exclusively. I don't even open drills for these cases. And then I go straight to the Dreal. But you can see where you get to that point, you're in that kind of far lateral recess. You're like, ooh, this is getting tight out here. And it's challenging to get out there. And so there's curved Caresins, and there's curettes and curved curettes and all the different tools that everyone's familiar with. But I think it's really tough to get all the way out to where you can see here. And this is definitely possible that these things definitely get all the way out there. And you just follow the nerve. So you basically, if you're doing a laminotomy going out your more cranial foramen, you just kick the nerve up essentially, and then you could use the protected shield, then you decompress down. If you're following the traversing nerve route and then exiting out, you keep your sleeve right against the nerve as you follow it out. But it allows you to go kind of back and forth on your way out the foramen. And instead of doing that with passes of a Caresin or then a curette, and sometimes with a curette, you're getting aggressive trying to do a nice foraminotomy, and you can get a fracture, a pars fracture, something like that, or break the facet off. So it helps kind of limit those situations. Here's just talking about less, trauma, but getting a really nice foraminal decompression versus a standard. And then a smaller laminotomy. And I think this is all accurate. It showed here, this was a study that was done where 163% higher increase in foraminal volume after the Dreal, and then less change in that width of the pars there. And this was a cadaver study that was done, looks like CT with 3D reconstructions for the volume measurements. Here's another video here. This is Dr. Pelosa, and this was I believe an example of going outside in. So those patients where you see, or maybe this was not, we'll see what happened, but you can see real bony stenosis. Yeah, so it looks like this is that outside in, and really just addressing just that foraminal stenosis. So a patient with more medical problems doesn't need a fusion, doesn't want a fusion, doesn't want a big open decompression, has a limited area of stenosis. Maybe it's been proven with transforaminal epidurals, they had short-term relief. However the case may be, I think everyone sees these types of patients in their practice. And this allows for a much smaller surgery, outpatient surgery. And you can see here the lateral part of the facet here, and then working in with the nerve root below. And there we go. So you can see that there. That's a nice view of what this does, just kind of slowly sort of carving out that foramen. And you see this sucker retractor down here. And then again with an upgoing curette, sort of feeling around, testing out, and then a micro nerve hook there, micro Murphy ball. Looks like things are pretty much free and clear. So that's an example there. This is where we're talking about the MIS TLIF, decompressing this way. You can see here how you can get to the other side, which I think is a really nice use for this device. Here you see real severe foraminal stenosis at L4-5, and this one was done inside out here, and facet's still intact and widely decompressed in the foramen. And you know, again, 77-year-old chronic renal failure dialysis. You know, obviously had a single neuroforaminal stenosis issue here with radicular symptoms, and it allowed for a small surgery to just treat his very focal problem and limit the chance of an infection or complication. Here's another case. This was someone's case where it was a younger patient with very specific left-sided foot pain, and had this osteophyte here that was removed with the Dreal. Looks like it was very quick in terms of the surgery. So just a very targeted approach right here, working inside out and clearing out that osteophyte and preserving the facet.